Nothing in this documentary has been peer-reviewed and published where necessary. All links to the peer-reviewed and published information is located on habitcough.com. Nothing in this educational documentary should be considered medical advice. Consult with and trust your doctors. That was me. I'm Bethany. I coughed over 500,000 times in 100 days when I was 12 years old. We only heard treat, suppress, and we'll keep an eye on it, but no doctor ever said the word cure. My parents heard about Dr. Miles Weinberger, MD, the world-renowned pediatric pulmonologist who founded and ran the asthma and cough clinic at the University of Iowa for 40 years. He cured me in mere minutes, as you will soon see. I have been a medical researcher and a worldwide patient outreach manager for him ever since. I met Dr. Weinberger near Annapolis, Maryland in May of 2022. Some people say that you should never meet your heroes. In this case, they were completely wrong. Now he's not just my hero, he is the world's hero. This is my story about Dr. Miles Weinberger, MD. My life changed back to normal after Dr. Weinberger instantly cured my horror cough. Now, an untold number of once hopeless and forsaken children and adults around the world have had their lives changed by Dr. Weinberger's cure. If my dad hadn't filmed what happened, even I wouldn't believe it. He told my dad that since my chronic cough was absent once I was asleep, though it was hard to fall asleep, he could cure it. This common chronic cough is properly known for millennia as habit cough. He told Mom and Dad that I did not need to fly across the country to meet him. He believed that he could cure me in a Skype video call. He said that he never manipulated his in-office patients and did not perform hypnotism. My parents had no other option. They were beyond despair since no medication or procedure helped at all. No doctor even mentioned the word cure, except for Dr. Weinberger. All they said was, "We'll keep an eye on it, and we can try to treat it." One doctor asked Daddy if he had any questions or comments. Daddy leaned in and said, "Say the word cure." The doctor leaned in and whispered, "There has never been a cure for a post-viral cough." He told my daddy that my cough could last a week, month, year, or even a decade or more. Daddy was shocked that there was no treatment or cure for the number one reason that people go to the doctor. Hippocrates first described what was to be known as habitual cough in the 1st century AD. As an adult, Tiberius Julius Caesar Augustus, the 1st century Roman emperor, was diagnosed with a habitual cough that was continually growing worse. Some doctors believe that habit cough only occurs in children. This chapter called Of Convulsions in Adult Persons from a 1685 medical textbook. Dr. Thomas Willis, MD, wrote, "A violent dry cough following her day and night, unless she was fallen asleep." This is Dr. Weinberger's exact habit cough diagnosis for children and adults from today. Cough, absent once asleep, only to return once awake. Just like your daytime only awake horror cough. And from a 1694 medical textbook concerning a post-viral cough in children and adults. Dr. Franciscus Mercurius van Helmont wrote, "Habitual cough, which often continues after the first cough, which was caused by the cold, is gone. This post-viral cough includes post-influenza habit cough, post-COVID habit cough, and long COVID habit cough, which has been cured in numerous children and adults." In his book, Illustrations of Unconscious Memory, in Disease, including a Theory of Alteratives, Dr. Charles Crichton, MD, wrote, "The stomach cough being really a habit cough, a reflex effect persisting after the cause is gone, and the treatment of it is to break the habit." From his habit cough in adolescent children, Dr. Bernie Berman comments on the phenomenon of habit cough and providing support and comfort during the period of treatment, and utilizing the art of suggestion. All 6 children improved and have been free of cough during a long-term period of observation. This is about me. Dr. Weinberger states, "In early February 2019, I received an email from a father of a 12-year-old girl with a 3-month history of a repetitive daily cough that was absent once asleep. His online search for help led to me. He and his daughter were at a location 3,000 miles from me. Her pediatric pulmonologist was prescribing inhaled corticosteroids, which were providing no benefit. Because she met the criteria for habit cough, I undertook, for the first time, delivering my usual suggestion therapy via Skype. The girl's father recorded the procedure and created a website, habitcough.com, that contained his daughter's history and an audio-visual recording. So much has happened since he instantly cured me in 2019. Most call it amazing. Many call it astonishing. Some even call it miraculous. I call it the Weinberger procedure. Hippocrates noted that on the 11th day the fever abated, and then he states that he coughed still. Then he states a fever attended at first, for 10 days, and a cough succeeded upon their breaking, meaning post-viral cough. According to Assessment and Management of Chronic Cough, in the United States, cough is the most common complaint for which patients seek medical attention, and is the second most common reason for a general medical examination, accounting for more than 26 million office visits annually. Per AJMC.com, there are no current FDA-approved pharmacologic treatments for chronic cough, daytime, awake, and absent want-to-sleep cough, resulting in a large unmet need for patients. This headline says it all. This could easily be the reason that you might have never heard the word cure concerning your acute or chronic cough. U.S. pharmacists state, unfortunately, the majority of therapies available are currently recommended based on historical practice rather than on scientific evidence. PubMed is the voice of the NIH. They recommend honey for coughing. Honey may be better than no treatment, diphenhydramine and placebo, for the symptomatic relief of cough, but it is not better than dextromethorphan. None of the included studies assess the effect of honey on cough duration, because intervention and follow-up were for one night only. There is no strong evidence supporting or against the use of honey. Very important. Be careful about giving over-the-counter cough medicines to children. Not all over-the-counter cough medicines are recommended for children of certain ages, especially dextromethorphan. References are on habitcough.com. Dextromethorphan, DXM, is a cough suppressor found in more than over 120 over-the-counter cold medications. It has questionable efficacy in treating a cough. There is no history of it curing a cough. DXM is widely abused and is known by the Drug Enforcement Administration as the poor man's PCP. According to the Rotterdam study, approximately 10% of adults suffer from chronic cough. 40% of this number are considered refractory, unexplained chronic cough. There is no accounting for the number of children who are suffering. I have learned so much by being a medical researcher and a worldwide patient outreach manager for Dr. Weinberger. Most every day there is some new and exciting revelation about adult and child patients around the world being cured. Dr. Weinberger, what is the story of your medical career?
Well, when I was a teenager, I had no interest in becoming a doctor. I was aiming to be a scientist. And I started out at Carnegie Institute of Technology as a physics major. And then changed my mind. I got interested in things besides science, more humanistic things. And I transferred to the University of Pittsburgh, stayed there, went to medical school, and found that applying my scientific interest to medicine could make people better.
Did your parents attempt to guide you?
No, my parents never tried to guide me. They expected me to do well and eventually go to college, but they never really talked about it or pushed me. I was pretty much on my own on deciding what to do. My father had graduated from the University of Pittsburgh. He had started out majoring in dentistry because that's what his mother wanted him to do. He didn't like dentistry. Graduated with a degree in history. Uh, but my parents never really tried to guide me or push me. I was pretty much on my own.
How did you become a pediatric pulmonologist?
When I finished medical school, uh, I was trying to decide what subspecialty I wanted to go into. I didn't want to do general pediatrics. I wanted to go into a specialty. And after 2 years of residency at the University of California in San Francisco, I fulfilled the that time the medical draft involvement as a member of the Public Health Service at the National Institutes of Health. And while there, I met uh, a couple of people, one who was at Walter Reed, and another after I went to Denver, person who was Dr. Elliot Ellis, who was head of the program there. And asthma was the major problem they were dealing with. And that interested me as a growing field where there was a lot to be done. And so I ended up with 2 years, actually ended up being 3 years altogether, at the National Jewish Hospital in Denver, which was an institution for children with severe chronic asthma. And I continue to have a major interest in that. And probably after I went to the University of Iowa to take over the division of allergy and pulmonary, asthma was a major problem that we had. And it was probably my major interest in my major area of scientific exploration for the first, at least for the first 20 years that I was there.
How did you learn about habit cough and its ultimate treatment and cure?
Well, just like a few people before me, when I would see children with this repetitive cough for most of the day after day, but not present when they were sleeping, uh, I suspected. Well, it didn't seem like it was any uh, physical cause of cough that I'd ever seen, and it just seemed to me to be a uh, an uncontrollable behavioral type cough that could be treated with a simple behavioral method. And I'd been doing that even before I ended up at the University of Iowa with the occasional patient I'd seen during 2 years in private practice in Marin County, California. Uh, but in Iowa, on a regular basis, every month or two, we would see a patient with this. And I would, just as a matter of treatment, we stopped the cough. And I taught my colleagues how to do it, and they stopped the cough. And then in the before 1991, I was demonstrated. Well, I demonstrated the technique to Boris Lokshin, who was my fellow at the time, and he said, "Well, that's very impressive. You stopped the cough on this young lady from the Chicago area who had been coughing for months. And for the parents, it was a jaw dropper. They had uh, been to every doctor they could think of, and a girl's 15-year-old girl who was a bright girl, did well in school, had a lot of friends, but the chronic coughing for months had really uh, destroyed a lot of her usual activities. And I stopped it through the art of suggestion, just as others had done before. And my fellow said, "Did they stay fixed?" And I said, "You find out." And that led to a follow up of our patients by my fellow. And we found out that, yes, there were occasional recurrences, but the patients were able to handle it just fine. They knew how.
How did you know what to do with your habit cough patients?
How did I know what to do? Well, it just seemed like a logical thing to do. This seemed like a uncontrollable, but yet non-organic and behavioral type of cough. And it just seemed natural for me to establish a relationship with the patient and convince them that they could hold back the cough. And they did. Subsequently, when I started searching the literature for other cases, there was that beautiful description of Bernard Berman, uh, who published in 1966 a article of seeing six children with that over a 5-year period in his practice. And he said he stopped them by what he called the art of suggestion. And that just seemed, I guess, even before I knew about his article, it seemed logical to me, just as it seemed logical to him at the time, to come up with by establishing a relationship with the patient and convincing them that they could stop the cough. And we did. And there are a few others who had done variations of that.
If you had to pick one characteristic of your habit cough diagnosis, what would it be?
A characteristic of the habit cough that is uh, different from most other uh, physical causes of cough is that, as bad as it is all day, and it tends to be quite troublesome, continuously repetitive, uh, sometimes in some multiple times per minute, sometimes spasms of coughing every few minutes. So it was a terrible cough for the patient, for the family, and yet once they were asleep, it was quiet. Asthma, one of the more common causes of cough, troubles sleeping. It tends to cough and wake them up at night. Most other causes of organic cough also true. Uh, that's true the majority of the time, and that's one of the sine qua non features of the habit cough. Totally absent once they're asleep. It doesn't wake them. They may wake and then cough, but they don't cough and wake from coughing.
Tell us about your 40 years at the University of Iowa. It sounds fascinating.
So over the course of the 40 years that ran the program at the University of Iowa, we had probably several hundred patients over that period of time. And in addition to noting the sine qua non that they didn't cough at night, no matter how bad it was during the day, we also observed that none of them ever responded to medication. There was no response at all to medication. That was a characteristic. So in 1996, I retired from the University of Iowa and came to San Diego, and I would get occasional communications with people that had run across some of my published articles and had children who had similar problem. But the most severe one that I got a call from was Dennis Buettner, who his 12-year-old daughter, Bethany, had severe coughing, disturbing her activities, disturbing the family's activities. And he was quite desperate about what to do for this horror cough that she had. So I agreed, since they were almost 3,000 miles from me, to do suggestion therapy remotely by teleconference. And to my great satisfaction, it worked just as well by teleconference as it had from the many patients I'd been involved with back in conferences in the clinics at Iowa. We were able to stop her cough. Her father did a video of that because he was impressed at how quickly she was able to stop coughing. Literally within minutes. She still was struggling to hold back the cough, but she actually was able to control the cough.
I could do anything any kid could do before my cough. When I couldn't stop coughing, it made me really sad. Dr. Weinberger taught me how to make my cough go away in only 10 minutes.
Yeah. I told you, right? The total number?
Yeah. We don't want to keep count of them. We just want to.
No. She wants to tell Hunter. Shh, tell him. Look.
This is
I planned on recording audio only, but about 3 minutes in, I realized something really incredible was happening. I picked up my wife's phone and I began to film because no one would believe what we were about to see.
Great girl. You've done it. Over 3 minutes. Hey. Once you cough once, try not to let it happen again. Just try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Mm-hmm. Still hard though, huh? Okay, we're going to go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. Mm-hmm. So I'll bet you can do 4 minutes too. Because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad, but you keep thinking by yourself. You keep control. Mom and Dad, are you there?
Yes.
Curing me via Skype was pretty incredible. Did you ever expect that children and adults would be cured just by watching the YouTube video of you curing me?
To my pleasant experience, she was able to control her coughing within minutes. You could see her struggling, but she wasn't coughing. Her father was so impressed at how quickly the coughing stopped and how effectively she was able to control her coughing that he started a camera to make a videotape of the experience of the session that stopped her coughing. And then he put that video on the web, hopefully for other doctors to see, so they could see an effective technique that we had been using for years in Iowa. It worked even remotely by teleconference. And then once it was on the web, something amazing happened. And then, since the video of me talking to Bethany was put on the web, hopefully for doctors to have that information, an amazing thing happened. Parents started telling us that their child watched the video and convinced themselves that they could do the same thing that Bethany did, and they stopped coughing. That happened in child after child. Some of them almost instantly. Others had to work at it for a few days and watch the video a few more times. But we had that happen probably about 100 times that we published.
One of my favorite cures was a little 8-year-old girl named Piper. She is a favorite because she stops coughing almost instantly, as you will see. She coughed for 6 weeks after strep throat, and nothing could make it stop. Her dad says, once asleep, Piper sleeps peacefully. When she wakes, the cough begins again almost immediately.
Now, what you do, and it's not easy. It's hard to do. You're pretty good at doing hard things. Okay, you are.
Are you? Honey, don't worry about me. You work with the doctor.
You just do easy things. You never do hard things.
I do hard things. I'm just not sure. I don't know. I think I'm pretty good.
Be serious, honey.
So, what I want you to do, getting my watch here, and the more you stretch it, the more it itches. And it doesn't heal up until you stop scratching it. It's the same thing. That feeling there that's making me coughing is going to take a while to heal up, and gradually it healed, and now she's just fine. Yeah. So it takes a while, and it takes some work. And Bethany emphasizes practice, practice, practice. So in other words, you have to keep paying attention. Now, right now, you're doing great. Don't think of anything else except resisting that urge to cough. Just keep listening to me and don't pay attention to anything else. And it's never come back. Things have to heal. It takes a while to heal up, just like it takes a while for a mosquito bite you've been scratching to heal up. Very much the same way. I think you can do this on your own now, don't you? What I want you to do is take the water, keep thinking, and let me talk with your dad again. You know how to do it. You can do it on your own now. Right?
Okay.
Okay.
Tell us about the amazing thing that happened with the YouTube video.
So what you just saw was an example of what can be done for habit cough and what my colleagues and I had done for 40 years at the University of Iowa. And other colleagues at 2 other institutions had done in more recent years. So this is essentially a demonstration of an established technique for this terrible chronic cough that's absent once asleep but responds to no medication.
Tell us about Abby from Australia.
A fascinating example of this was a 15-year-old girl from Australia who had a history of 5 years of chronic cough, not responding to any medication, that was totally absent once asleep. So she had the habit cough for 5 years. And what you're going to see is her recording her own experience, watching the video of me talking with Bethany.
I'm Abby's mum. Your child's cough might be habit cough. Watch Abby's instant cure video utilising the Weinberger procedure. It's amazing. Tell your doctor what you've seen. Dr. Weinberger is providing this miracle Weinberger procedure as his gift to hopeless and forsaken children and parents in Australia and around the world for free.
If you start feeling anything, don't take a lot of water, but just a little sip. Okay. So what we're going to do for a little while is some of the things I told you, but I'm going to help you a little bit. You're still going to do it. Okay. First thing I want you to do is keep looking at me and listen to me, even when you start to feel like you're going to cough. Okay? And we'll start going just for a little bit. And remember, it's hard to cough, right? Very hard. Because it's hard to concentrate on just holding back a cough. It really takes a lot of thought. So I'm going to watch my watch here. you start to cough, as soon as you feel that, concentrate on holding back the cough and take just a little sip of water to ease that feeling. Okay. So, keep looking at me and concentrate. And let's go just for half a minute now. Instead of coughing, slow deep breath. Slow again.
My full session with Dr. Weinberger is on our website.
Hi, I'm Abby, and here goes me trying to cure my habit cough with just Dr. Weinberger's suggested therapy. I'm gonna not cough for 15 minutes. I usually cough for what feels like 100 times per minute, and I've been coughing for the past 5 years. So here I go. Thank you so much, Dr. Weinberger, for helping me. Now I know how to control my cough.
Remember when I used your procedure 6 months after you cured me?
About 6 months after this amazing experience of stopping Bethany's cough by teleconference, I got a frantic call from the father that she had a cold, the whole family had a cold, and Bethany started with this characteristic repetitive coughing. We didn't have to wait for it to go on for weeks to be convinced what it was. The characteristics of the cough are so unique that it was clear this was the same cough coming back. He asked me what to do. And I said, tell Bethany she knows what to do because she did it before. He told her that, and she stopped coughing. I've had this experience with other parents where the cough comes back later and the child remembers, is told that he knew what to do, and then he stopped it. I asked Bethany a year or two later when I met her in Maryland, and I asked her, how did she know how to stop it? And she said, well, she'd done it before, and it was like riding a bike. If you've done something like that, maybe months since you've ridden a bike, but you still know how to ride a bike. So she just had to remember how she stopped the coughing when I talked with her. But the point is, she's the one who stopped coughing. I just helped show her how, and she was able to do it again.
What do you mean when you say by proxy?
So we found that just watching the video was effective. And that's what we meant by proxy. It didn't involve me or any other physician. It just involved the patient and the video on the web, just from watching it. It seemed to impart the suggestion to the child that if Bethany could do it, they could listening to me do it with Bethany, and they could stop coughing also in a very large number of children. Obviously, there are exceptions, but they were small.
Now you contact and cure children and adult patients from around the world via teleconference. Tell us about it. It really does sound miraculous. Oh, and tell us about the little girl from Gujarat, India named Hare.
In addition to the children who responded just from watching the video, once or twice a week, I would have parents communicating with me, asked if I could actually talk to the child, to their child, in the same way that I talk with Bethany. And I've talked with children from all over the world, from several from England. In fact, we have a video with me talking with 9-year-old James in Manchester. The mother recorded the video, and others from all over, from North Macedonia, for instance, and from India. And one of the ones from India, we've had several in India now, 11-year-old girl with the name of Heer, H-E-E-R. Yeah, stopped coughing. And the mother, who was a physician, was so happy because Heer had been coughing for months. Again, just like all these children, it makes them unable to go to school, to have social activities from constant coughing all day. So the mother and the daughter both did a translation in their own language. And the girl, actually, you can see her doing the same thing that I had done as remotely providing suggestion therapy, but doing it in native Hindi.
Namaste. I am Heer Mehta from Ahmedabad, Gujarat, India. I am 11 years old. I was suffering from continuous dry cough for 1.5 months. My pediatrician diagnosed that I had habit cough. So, my parents contacted Dr. Miles Weinberger through habitcough.com website. Dr. Weinberger sir immediately replied and arranged a video session with us. He cured me with his suggestion therapy, which I am going to translate in Hindi. I am also so much thankful to this living legend on the earth. I hope that this video will help you too. Let's begin. शांत रहिए, आप बहुत अच्छा कर रहे हो। सिर्फ और सिर्फ मेरी बात पे ध्यान दीजिए और कहीं मत देखिए। दूसरी कोई भी चीज़ या व्यक्ति के बारे में मत सोचिए। आपके मन में खांसी को रोकने के अलावा और कोई बात को मत आने दो। आपको सिर्फ एक ही काम करना है। खांसी आने से पहले यदि गले में अजीब फीलिंग लगती है तो तुरंत एक घूंट पानी पीने। ठीक है, कुछ समय के लिए हम एक कोशिश करेंगे जिसमें हम पानी पिएंगे और मुंह से सांस लेंगे और इस दौरान मैं आपकी मदद करूंगी। अच्छा, सबसे पहले अगर आपको खांसी आए या आपको लगे कि आपको खांसी आने वाली है, फिर भी आप मेरे सामने देखेंगे और मेरी बात सुनेंगे। ओके, तो हम कुछ वक्त के लिए कोशिश करेंगे। और मुझे पता है कि खांसी रोकना मुश्किल है, बहुत मुश्किल है ना, बराबर? अगर हम ध्यान लगाकर कोशिश करेंगे तो कुछ पल के लिए हम खांसी को रोक पाएंगे। तो चलो हम कोशिश करते हैं और आप यह कर ही पाएंगे। आप आधी मिनट तक खांसी को रोक पाए हो, तो अब हम 1 मिनट तक खांसी को रोकने की कोशिश करेंगे। ध्यान दीजिए, अगर आपको ऐसा लगे कि आपको खांसी आने वाली है तो तुरंत एक घूंट पानी पीजिए। मेरी बात पर गौर कीजिए और खांसी को रोकने का सोचिए, क्योंकि जितनी देर तक आप खांसी को रोकेंगे, खांसी को रोकना उतना ही आसान होता जाएगा। अगर आपको ऐसा लगे कि आपको खांसी आने वाली है तो तुरंत पानी का एक घूंट पी लीजिए, ठीक है? तब पानी पियो। बहुत अच्छा। अभी और 40 सेकंड के लिए खांसी को रोक के रखिए। जितने लंबे समय तक खांसी को रोक के रखोगे, खांसी रोकना उतना ही आसान होता जाएगा। बहुत अच्छा। आप 3 मिनट तक खांसी को रोक पाए हो। ध्यान दीजिए, आप बहुत अच्छा कर रहे हो। ज़रूरत मुश्किल है पर आप बहुत अच्छा कर रहे हो। ज़रूरत लगे तो एक घूंट पानी पीना। अब आप कोशिश कीजिए कि आपके मन में खांसी का विचार आए तो भी आप खांसी को रोकेंगे। आप बहुत अच्छा कर रहे हो। अगर ही है, आप जितनी ज़्यादा खांसी खाओगे, आपको उतनी ज़्यादा खांसी खाने की फीलिंग आएगी और उसकी वजह से आप फिर से ज़्यादा खांसी खाने लगोगे। अगर मच्छर ने हमें काटा हो तो उस वजह से हम खुजली करना बंद करेंगे तो हमारी खुजली कम होती जाएगी। वैसे ही आप खांसी खाना रोकेंगे तो खांसी की फीलिंग कम होती जाएगी और आपकी खांसी कम आएगी। मैं भी मानती हूँ कि यह मुश्किल है, फिर भी आप कर सकते हो। अगर खांसी को रोकना इतना आसान होता तो हमको इतनी कोशिशें करने की ज़रूरत नहीं होती। और कहीं मत देखिए, दूसरी कोई भी चीज़ या व्यक्ति के बारे में मत सोचिए। आपके मन में खांसी को रोकने के अलावा और कोई बात को मत आने दो। आपको सिर्फ एक ही काम करना है। खांसी आने से पहले यदि गले में अजीब फीलिंग लगती है तो तुरंत एक घूंट पानी पीजिए। बढ़िया। मुझे पता है कि मुश्किल काम है, पर आप बहुत अच्छा कर रहे हो। आपके मन में खांसी को रोकने के अलावा और कोई विचार नहीं आना चाहिए। ध्यान दीजिए और मन लगाकर सोचिए कि आपको खांसी नहीं खानी है और उसे रोकना है। गहरी सांस लीजिए या फिर एक घूंट पानी पीजिए। जब हम अपने मन में ऐसा सोचेंगे कि मुझे खांसी नहीं खानी है, तब हम ज़रूर अपनी खांसी को रोक पाएंगे। यह आसान नहीं है, फिर भी आप यह कर रहे हो क्योंकि आपने 6 मिनट तक खांसी को रोक के रखी है। ध्यान देते रहिए और दूसरी कोई भी चीज़ के बारे में मत सोचिए। मुझे पता है कि आप यह खांसी को रोक देंगे और उसे दूर भगा देंगे, ठीक है ना? क्योंकि अब आप खांसी को रोकना सीख रहे हो और आपको यह करना आ गया है। मुझे पता है कि आपको खांसी बंद हो जाएगी क्योंकि आप उस पर ठीक से ध्यान दे रहे हो। एक बार खांसी आएगी तो दूसरा होता जाएगा। मुझे बताइए कि खांसी को रोकना पहले से आसान हो गया है ना? मैं जानती हूँ कि खांसी अभी तक गई नहीं है। अभी भी आपको शायद ऐसा लग रहा होगा कि आपको खांसी आएगी, फिर भी आप उसे आसानी से रोक सकते हो। आपका मन खांसी आए उससे पहले उसे रोक सकता है। ठीक है, बढ़िया। आपको आने वाली खांसी बहुत कॉमन नहीं है, फिर भी मैंने ऐसी खांसी वाले मरीज़ देखे हैं और सभी मरीज़ की खांसी इसी तरह से, और इसमें मैंने कुछ नहीं किया है। मैं सिर्फ आपको खांसी रोकना सिखा रही हूँ, पर उसको आप खुद रोक रहे हो क्योंकि आपका दिमाग बहुत शक्तिशाली है और आप अच्छी तरह से खांसी को रोकना सीख रहे हो। करते रहो बहुत अच्छा। और आप अपने आप खांसी को रोक रहे हो। इसका मतलब यह हुआ कि जब मैं आपके सामने नहीं होंगी तब आप इसी तरह से खांसी को रोक पाओगे। मुझे यकीन है कि आप यह कर पाओगे और अपने आप खांसी को रोक पाओगे। आपको पता है कि खांसी आए उससे पहले आपको और खांसी रोकनी है। गहरी लंबी सांस लीजिए। बहुत अच्छा। आप कुछ देर तक आप अपने आप खांसी को रोकने की कोशिश कीजिए। खांसी रोकिए, ध्यान दीजिए। फिर से धीरे से एक गहरी सांस लीजिए और याद रखिए कि आप अपने आप से खांसी को रोक सकते हो। आप जितने जानते हो कि एक घूंट पानी पीने से आप खांसी रोक सकते हो। एक भी खांसी आए तो तुरंत सोचिए कि मुझे यह खांसी को रोकना है। आपको मेरी ज़रूरत नहीं है और मैं जानती हूँ कि आप बहुत अच्छा कर रहे हो। प्रैक्टिस के लिए बार बार इस वीडियो को देखते रहिए। आप बहुत अच्छे से खांसी रोक रहे हो। वेल डन। यदि ज़रूरत लगे तो इस वीडियो को फिर से देखिए। हमारी वेबसाइट habitcough.com पर डॉक्टर वेनबर्गर के द्वारा की गई ट्रीटमेंट का वीडियो है। यह हमारा डॉक्टर वेनबर्गर के साथ का सफल और बहुत अच्छा अनुभव है। आपका अनुभव अलग हो सकता है। आप अपने डॉक्टर, पीडियाट्रिशियन या पल्मोनोलॉजिस्ट के साथ इस वीडियो के बारे में और habitcough.com के बारे में बात कीजिए। यह वीडियो एजुकेशनल पर्पस के लिए ही बनाया गया है। यह वीडियो रोग के निदान और सारवार के लिए नहीं बनाया गया है। धन्यवाद।
So that was very impressive for an 11-year-old girl. And she wanted to do this because she wanted the millions and millions of Hindi children who don't speak English, who might not be fluent in English, to be able to have the experience of controlling their habit cough by watching the video. This has now been done in 8 different languages, the same experience. A child responds to the initial video, and the mother, and in some cases, the child doesn't speak English, and so the mother records it in their language. And hopefully, there will be more languages that parents use to use their voice using my words in the YouTube experience of watching me treat Bethany. Just a little. That's better. Okay. So this has been a real nuisance for you, hasn't it?
Yeah.
Sometimes this happens to other kids too. And it's hard to do because your body wants to cough, but your mind can control it for a short period of time. Okay. Keep concentrating. Think of nothing else. Just listen to my voice and don't listen to anything else. Don't let anything else in your mind except be aware of that feeling and take the sip. Okay? It's great. You've got a minute, and you've been very good at it. You've really got it. You've really got it. And you notice that the longer you go, it gets a little easier. Not a lot easier, but a little easier, right? A little easier to suppress your cough. Right. Okay. So we're just going to keep this up. Stay focused. Don't let anything else in your mind. Make sure that you've got enough water there so that you can sip on it to ease the feeling. Ease the feeling. This has happened to hundreds of kids and also adults. And the more you use your brain to control it, the more it allows it to heal up eventually, so it stops being a problem. So keep concentrating. We're going for a total of 10 minutes altogether. We're going to make it soon. It's going to be 10 minutes. And if you can do it for 10 minutes and you keep practicing, you can do it forever, which is what you wanted, that, isn't it? But you're getting very good at it. And so what you'll find you'll have to do is the same thing Bethany had to do. Practice, practice, practice. So sometimes when you feel the cough coming back, go off by yourself with some water and do exactly what we're doing now. So, and watch the video if that helps. You decide what helps. You can watch the video. What do I do? And I told him, tell Bethany she knows how to do it, and she knows how to do it. She stopped it herself because then she knew how. So once you know how, you can stop the tickle from occurring. Okay? Do you have any questions for me?
I don't think so.
Okay. If you ever do, you and your mom, you could arrange for your mom and dad to contact me, and I could talk to you again, or we can just do it by email, whatever works.
Yeah.
But you may have to repeat it because it takes a little while for that feeling to go away, for it to heal up. It's kind of like, do you ever get a mosquito bite?
Yeah.
Yeah. And it itches, right?
Mm-hmm.
And you ever noticed that the more you scratch it, the more it itches?
Yeah.
And it doesn't heal up until you stop scratching it.
Mm-hmm.
Kind of like that. You got to stop. The coughing is scratching in there and causes more coughing. But you know how to do it now. With practice, that's going to heal up and go away.
Yeah.
Okay? So why don't you go off by yourself now when we talk with your mom and dad? Okay?
Okay.
And anytime you want to talk again, we can. It's up to you.
Mm-hmm.
Anytime you want to watch that video, just have your parents set it up so that you can watch it if you want to. Anytime you want to, because you're the one that's taking control here. Your parents can't stop the coughing. I can't stop the coughing, but you've now shown that you can.
Yeah.
You worked hard. It's hard to do, but you did it. And you're going to have to keep doing it for a while. But it's going to gradually get easier. The longer you go, the easier it's going to get. Okay? You go off now and let me talk with your parents, okay?
Thank you.
Tell us about habitcough.com. I have a great time editing it with my daddy.
A few months later, Bethany's father showed me that he, with Bethany's help, had put together a website called habitcough.com, where he progressively added the experience that they've had, the experience that others have had, and he went into the history of habit cough and found that descriptions of habit cough date back a couple thousand years. And the descriptions, especially in some of the 17th century medical books, described very much exactly what we've seen, that the patient had a cough, a cold with a cough, and often the initial cough is different than the habit cough. And parents often say the child had a cold with a cough, but then the cough changed. Habit cough is more unique. It doesn't sound like any cold that they've had before. And this is described in some of these articles, that the cold went away, but the cough persisted. The habitual cough persisted. And even one article from the 19th century described this terrible cough in a woman that was terrible the whole day, day after day, except when she was asleep. Just like our current observations of what characterizes the habit cough.
Some medical doctors believe that habit cough is exclusively a pediatric concern. The 1685 medical textbook refers to convulsions in adults. It references an adult female with habit cough that is absent once asleep.
As I mentioned, we were getting feedback from our studies and from our description that included not just parents telling us that their child responded to watching the video, but adults also were responding. And the adults often were giving us stories about how miserable they had been, not just for months, but for years of chronic coughing, which interfered with their ability to function. And it was the same type of illness that the children described. That is a chronic repetitive cough during all waking hours that was totally gone when asleep. Non-productive cough, just like the children. So it became apparent to us that habit cough was not limited to children, but also occurs in adults. And that was consistent with the older literature that we had run across that referred also very obviously that these were adults that were being described. And at least one article in one medical book in the 17th century specifically mentioned that the problem was in adults. But all of the ancient literature really that described the habit cough really were talking about adults.
You have a great story about Heather, the female judge from Iowa. Can you tell us about her?
One dramatic description we received was from a 62-year-old woman at the time who had had chronic cough for 10 years. She was a municipal court judge in Des Moines, Iowa, and she reported that every 10 minutes throughout all waking hours, she would have a spasm of non-productive coughing. Went on day in, day out for 10 years. Again, as is typical of the habit cough, she did not cough once sleeping. And she was able to continue her job, but all around her were very tolerant of this spasm of coughing every 10 minutes, but it made her life miserable. And she was very happy to find that when she watched the video, she was able to stop coughing. The next day, she went on about her affairs and had no coughing. She indicates that she continues to need to be aware of it and still has the urge to cough, but she no longer coughs. It no longer controls her life like it did before.
Hi, my name's Heather Dickinson, and I live in Des Moines, Iowa. I am a part-time magistrate judge, which means that I handle small claims cases, mental health cases, and traffic and simple misdemeanor cases. It's a pretty hectic job. I only work 2 days a week, but it's chaos basically at work. About 12 years ago, I had an inflamed, infected uvula, and I had that taken out by an ENT. I had been coughing before from the fact that my uvula was resting on my throat. It was so swollen. And so I went to an ENT. He diagnosed me with an infected uvula and said he would take it out. And it was a pretty straightforward procedure and I would be fine. So who knew? Throat surgery is extremely painful. I have a pretty high tolerance for pain, but within a couple hours, I was taking my liquid pain medication and I was not coughing, which was great. That lasted for about 3 or 4 days. I continued to take the liquid pain medication, but the minute I stopped taking the pain medication, I started coughing again. And the interesting thing about my cough was it would start out as a tick feeling in my tickle in my throat, and then it would just keep going, and I literally could not stop. Interesting, I found that I coughed when I was stressed, when I was busy at work, when I was trying to get somewhere in a quick, I was running late, for example. The times I never coughed at yoga. I never coughed when I was walking my dogs. I rarely coughed when I was out socializing. I never coughed if I was out enjoying cocktail hour. If I had a cocktail, I would stop coughing, and I did not cough at night. So I was pretty confident that it was a tick, but as hard as I tried, I kept coughing. And pretty soon it got to the point where I drove my family, especially my teenage boys, insane. When I was on the traffic docket for 1.5 years straight, police officers would come to court and look at my court attendant and say, "Is she still coughing?" Everybody knew at work that I was a cougher, and it was pretty embarrassing. I kept going back to my ENT, and he actually was a great guy. He knew there was nothing wrong with me. What he suggested I do was go on vacation. I went on vacation. I kept coughing. Over the years, I went to see my regular internist, and she was great too. What she told me was, it's a tick, but what happens when you cough from a tick, when you're stressed, for example, or rushing, that it then inflames the areas of your throat, which then cause you to cough. So it's kind of a vicious cycle, is how she explained it to me. I was fortunate in the sense that I had a gut feeling that it was a tick cough. I was tested for GERD. I did take that step. I was tested for allergies just to be sure. I did have a lung x-ray at one point, but that's really all I did. I'm not a huge fan of going to the doctor. So, and in my gut, I just knew by the cycle of my cough and how if I say, I would go to New York frequently. If I went to a Broadway show, I'd never cough because I would be engaged in watching and entertained. I would never cough in yoga or when I was exercising. So it was pretty clear to me that when my mind went, I coughed all the time, sitting on the bench listening to trials and cooking dinner. So I think that whenever my brain would wander or whenever I was stressed, one of the biggest triggers for me would be getting in my car if I was rushing, if I was late for work, late to an appointment. I would start coughing. And once I started, I could not stop. Basically, I drove my family insane, especially for my youngest child. It really irritated him. My husband and my older son seemed to tolerate it, but not my youngest child. And he actually was the one that discovered Dr. Weinberger. He read an article and he reached out to Dr. Weinberger. And that's once we made a connection, and I saw Brittany's tape, it was amazing. Now, what I will say is that it was super hard. I had been drinking hot tea and iced water, but Dr. Weinberger was pretty confident that I should stop doing that and simply have tap water. I will say when I started, I have a lot of Hydroflex water bottles, so I don't have to buy plastic water bottles, but there was something about having a plastic water bottle in my hand. I don't know if it was comforting, but I couldn't get the same relief, if you will, from carrying around my reusable water bottles. For some reason, I had to have a plastic water bottle in my hand. I basically, the first 3 days were horrible. The first day being the worst. I really couldn't do anything because I really just had to sit there and concentrate on not coughing. Each day got a little bit easier to the point where then I wasn't coughing. I haven't been quite as lucky as Brittany. Maybe it's because I'm older. Old habits die hard, and I did cough on and off for probably 10 years. I've had a few mishaps, if you will, over the years since I first saw Brittany's tape. I watch it occasionally when I start to fall off the wagon, if you will. But it is remarkable. For example, I was recently on a backroads trip. I went to Paris for several days, and then I went to Greece to hike on this backroads trip. I did not cough once. I got a bit of a cold on my way home. I got stuck in New York for 3 days. It was incredibly stressful. I must have purchased 3 different airline tickets on 2 different airlines to try and get home. I was stuck in a hotel. It was pouring rain in New York, and I started coughing again. And so the last couple weeks since I've been home, I've been struggling a little bit more than usual, but I am getting back on track. The most important thing for me is I know that I can stop. I've done it before. I know I can. And sometimes I feel like when I start to have a coughing attack, which I rarely have anymore, I might clear my throat or cough once or twice and throughout an entire day. But I know, which psychologically is, for me anyway, is the most important part, I know that I can stop coughing. I know that if I try hard enough, it will stop. And so again, getting stuck in New York, having a cold, and then I had a sinus infection. I've struggled a little bit in the last 3 weeks, but I'm now getting back on track. And I know I can do that. And once I fully am back on track, I can go for long periods of time without coughing. But it is definitely a habit cough. It's interesting. I have encountered some friends and strangers, middle-aged women who have the same cough that I do. And I have tried to tell them that they need to give this a chance, depending upon their personal situation. I would never tell anyone they shouldn't go see a doctor, but I know someone that I used to work with that has been all over the country meeting with doctors who tell her, oh, there's something wrong, it's not a tick. And I actually tried to explain to her that she needed to be open-minded to the fact that it was a tick and that she could stop if she tried Dr. Weinberger's suggestions and watched Brittany's tape, and she wasn't interested in hearing that. And I've heard through the grapevine, I haven't seen her in a couple of years, that she's still coughing and she's still looking for that medical cure because she's convinced that a pill or a surgery or something will solve her cough. And I'm pretty confident that she's had just about every test out there. I think the most important thing if you have a habit cough is you have to admit to yourself that it's a habit cough. And you have to be willing to take a couple days of your life and focus on it. But if you can't admit it, you're never going to recover from it. And I was lucky enough to have had doctors who told me to go on vacation, which is basically a way of telling me it's a habit cough. And a child that took the initiative to reach out to Dr. Weinberger. So I'm super grateful to Bethany. It was really helpful to watch her video. That's what got me started on the track to stopping coughing. But it is, for some of us, a constant struggle. Because the problem is once you let yourself cough again, you start to go down that rabbit hole, and you have to be really careful about that. And it is, I likened it to an addiction the other day. It is something that, at least for me, that I work on, not every day. I can go a month, 2 months, 6, I've gone as much as 6 or 8 months without coughing. But then if I get a cold or a sinus infection or I get super stressed, I can feel it come back and then I have to reel it back in. But for the most part, my life has changed so much for the better. The police officers that come to traffic and misdemeanor court are no longer asking if I'm still coughing. For the most part, when I'm at work, I don't cough. When I go out socially, I don't cough. I can go to the theater and I don't cough. I go to movies and I don't cough. I still struggle a little bit when I get in my car. I'm kind of a freak about being on time. And so there are still things that will trigger my cough, but for the most part, my life has changed for the better. Thank you to Dr. Weinberger.
One of everyone's absolutely favorite story is what we call the Gracie story. She is wonderful, and her story is truly inspiring. It has brought so many once hopeless people to you to be cured.
As incredible it was for Heather, we've had stories like this over and over again. We've had many patients who have had different patterns of their cough, sometimes multiple coughs per minute, multiple coughs per hour. They often estimated 1,000 or more coughs per day. And when they watched the video, I remember one patient saying there was something about watching Bethany learn to control her cough. And Dr. Weinberger's talking to her and following the same pattern. Adults often said, if a 12-year-old girl can learn not to cough, maybe I can do that also. And they found that listening to me talk to Bethany, sometimes once, sometimes multiple times, sometimes having to practice on their own, they were able to stop their coughing. They were able to change their life from years of coughing. I remember a 16-year-old boy who had been misdiagnosed at Philadelphia Children's Hospital neurology office as having Tourette syndrome. And for 2 years, he decided that was going to be his life, and he would be coughing all his life. After he saw the video and saw that it could be stopped, and helped with me talking to him, he was able to stop his coughing, and he said it was life-changing for him. Many adults have come up with very similar stories. We don't know how many adults have seen that video and never contacted us, but we know from searching the web that there are some like that who have not specifically talked with us, but told us that watching the video enabled them to stop talking. And so this demonstration of suggestion therapy by proxy appears to be effective, probably in a substantial number of adults who have undiagnosed chronic cough or have not been responsive to all standard treatment, called refractory common cough.
Hi, I'm Gracie Terzian. I'm a singer and songwriter living in New York City, and I have dealt with habit cough basically my entire life. It would always come after I had some sort of virus or cold. After the cold went away, I would have a cough that would linger for sometimes months at a time, and it was very frustrating. Especially as a singer, since my voice, I would become so hoarse I couldn't sing. It was very, very frustrating. I would often have to cancel things, and yeah, you really can't sing if you're coughing and hoarse. But I had gone to just every kind of doctor possible, pulmonologists, ENTs, everything. And I was treated for asthma. I was treated for acid reflux. I was treated for, given all kinds of antibiotics. I was given all types of cough suppressants, every kind of opiate you can imagine that could potentially suppress a cough. And sometimes the opiates would help and work a bit. And sometimes the acid reflux reduction techniques, whether it be through eating or through medicine, would help a little bit, but it never really cleared it up for good. And yes, it was just a constant struggle and battle. And it wasn't until I discovered Dr. Weinberger's videos on YouTube and discovered even the term habit cough that I went, oh, this is what I have, I think. And when I tried the sipping water technique, it was pretty insane and miraculous, because it went away within 2 days, my sort of debilitating cough. So I was very grateful to discover it.
An issue that I've been dealing with for probably most of my life is that when I get a cold, it can be any kind of cold, common cold, flu, whatever, I will oftentimes develop a cough during that cold. And then when the cold goes away, the cough just keeps going on and on and on for months. And I've been to, I can't tell you how many doctors, pulmonologists, ENTs, asthma doctors. I've been on every kind of medicine, tried every kind of different treatment, everything I've tried to eat and not eat to cure it. And I finally figured out how to cure it. And it's actually really kind of hilariously simple. And so I wanted to share it with you guys because maybe you have a cough that won't go away as well. And I'm telling you, no doctor ever told me to try this treatment out except this one doctor, and it really, really worked. I have always, when I get a cold, whatever, any kind of head cold, once the cold is ending or is about to end, I will develop a cough that then won't go away. And the cough can last for months and months. And sometimes the cough is so violent that I will, I'll go into these coughing fits that make me throw up. I mean, I've been walking down the sidewalk, I start coughing, and I start puking on the sidewalk. The way I would best describe it is that every time I would take a breath in or out, it would like tickle my cough reflex. So anytime I would breathe, I would feel the urge to cough. Super annoying. Maybe you've experienced something similar. So the main sort of diagnosis that I received from doctors was that when I was getting sick, you get mucus and phlegm in your throat, and then the phlegm was triggering my cough, and then it was also triggering my asthma, and then also acid reflux was triggering my asthma as well. And so the three of those things, the phlegm, the mucus, the acid reflux, and the asthma were all kind of irritating each other and going in this circle. So I've been put on all kinds of different medicines to stop all three of those things. The goal was to try to treat those three different things to see if you could eventually sort of calm the system down. So what I finally discovered was this term called habit cough. And so once I discovered this term habit cough and started reading about it, I was like, yes, okay, this is what I have. And then the treatment from this Dr. Miles Weinberger really just completely cured me. But let me tell you just a little bit about it quickly. So habit cough is defined as a cough that only happens during the day when you're awake, or just when you're awake. Doesn't matter if it's day or night. When you're awake, you're coughing, but when you go to sleep, it disappears. It goes away completely. So maybe you're coughing at night as you fall asleep, you're having trouble falling asleep because of the cough, but then right when you do drift off, you go to magical dream world, your coughing stops. Especially as I was getting ready for bed, but then once I did drift off to sleep, it didn't bother me. And then oftentimes when I would wake up in the morning, it was a little better, and then throughout the day it would just get worse and worse. Sort of culminate in the evening and be very bad. So basically what's happening with habit cough is that when you get a cold, you'll just develop a cough, which is pretty normal for a cold. But then for some people, the cough will irritate their airways, and then because their airways are irritated, they will continue to cough. And then as they continue to cough, it will keep their airways irritated, and then since their airways are irritated, they will continue to cough. But the funny thing is that it actually does really work, and as I've developed a cough multiple times now, I've tested it out each time, and every time it has totally zapped it instantly. So here's what you need to do. Basically, at first, it's going to be extremely hard to suppress the coughs, especially if you've been coughing for a long time. Like let's say you've been coughing for over a month. It's going to be really hard at first. But what you're supposed to do is you're supposed to carry around the entire day with you a glass of room temperature water. And every time you feel the urge to cough, you're going to take a sip of the room temperature water. Not a big sip, not a small sip, just a regular sip. And you're going to focus with just every little cell in your brain, you're going to focus to try to not cough. And it's going to be really, really hard. I mean, you're going to be squirming in your skin, it's going to feel like it's basically impossible, but you have to just do everything you can to suppress it. And the thing is that the longer you can go without coughing, maybe it's just 5 minutes you can go first. That's fine. 10 minutes. The longer the increments of time that pass by where you haven't coughed, the more time your airway can heal up. And then it actually becomes easier because as your airway heals up, you will lose the urge to cough.
that was my video I posted on YouTube. I felt compelled to make it because I was just so blown away by how easy the method was and how successfully it worked. So I posted this video on YouTube, and I think now it has over 40,000 views. And there's just tons of comments from people who say that it's worked for them and it's helped them. So it's pretty incredible. And I think what's even more incredible is how many doctors I went to who never knew about this technique or suggested it as well. So, it's kind of a funny way to find out medical advice, through a YouTube video, but that's how I found out about it. And so I'm very grateful. So I wanted to sort of spread the word as best as I could. And here I am now, almost 40 weeks pregnant, about to give birth. And I'm extra glad now that I know about this technique and procedure, because especially when you're pregnant, coughing a lot can be very difficult and troubling, especially if you have pelvic floor issues or all kinds of problems like that. So it's definitely not a good time to be coughing a lot. So I'm very glad I discovered this procedure. It's so simple, it's so easy. That's sort of the almost funny part of it, is how simple it is. And yeah, I'm just very grateful.
There are so many variations of the sound of habit cough. Tell us about them.
Well, the classic version of the habit cough that's been described in the literature is a loud, harsh, barking cough that one Canadian mother said sounded like a Canadian goose. But at the University of Iowa, we had shown that 10% of the children, had a soft cough, almost just like exaggerated throat clearing. And because of the demonstration by different parents of their cough, we have put together a number of those to show the different types of cough that occurs among the different children.
अरे टिप देने की कोई जरूरत नहीं है ये उनके मकसद
I remember when Daddy came into my room and said, "It's in the wild." He was so excited that doctors from around the world began referring their most dire habit cough cases to habitcough.com. So many have been instantly and permanently cured. Tell us about this.
Just as we reported the experience of many patients, both the parents of children with chronic cough and with adults who watched the video and found that they could then have cessation, complete cessation of their coughing. We then did a survey of pediatric pulmonary specialists through a listserv that we have. And we now have a list of 45 pediatric pulmonologists from the United States and 11 other countries who have indicated that they use suggestion therapy essentially doing the same thing that we did in Iowa for years, that they now do this themselves and diagnose and appropriately treat children with chronic cough from habit cough. So this is now recognized among the pediatric pulmonologists. The next goal is to convince more adult physicians that they can do the same thing, either refer patients to the website or, better yet, take responsibility themselves and do what I did with children and adults. If I did it, my colleagues have done it, then they can do it. And that's going to be very important, because that's the group of people that are seeing the adults with chronic cough. And they can also learn how to treat habit cough just as we did, or at least refer patients to the website where adults can then treat themselves by what is essentially suggestion therapy by proxy.
Tell us about your peer-reviewed and published papers concerning habit cough in adults. They are quite fascinating.
Since we were getting reports from the adults, I decided to look at the first 20 who had reported to us and publish that in an article that we titled Habit Cough is a Cause of Chronic Cough in Adults. Now, that's not all adults, okay, but I think among the adults, and over 40% of adults at specialty cough centers are classified as undiagnosed or refractory to usual treatment. Some portion of those, not yet defined, but needs to be defined, actually are habit cough and responsive to direct or proxy suggestion therapy.
I love when I can call you Professor Weinberger. You love teaching young doctors. What can you do to teach them about habit cough in children and adults?
And now I'd like to talk about the efforts, both successful and unsuccessful, in teaching the medical community about habit cough and how to treat it. I have been very successful with regard to the pediatric pulmonary community. I've been invited to talk and give information, give presentations about habit cough in the United States from coast to coast, from Johns Hopkins in the East to Los Angeles Children's in the West, and many in between, a total of 10 times. I've also been invited to talk at a pediatric pulmonary meeting in London, unfortunately remotely. Didn't get to go to London. But also before that, a couple years ago, I had been invited to talk at a pediatric pulmonary meeting in Taiwan. So in that sense, I've been successful in communicating about habit cough with my other colleagues in pediatric pulmonary. Where I have not yet been successful, and where I'd like to be, and where there's a need for effort, is among those who take care of adults with chronic cough, many of whom we have now shown and published that adults with chronic cough can have habit cough. And it is now a challenge to my colleagues who take care of these adult patients to determine how many fit the characteristics of habit cough. That is a repetitive, non-productive, daily cough that is totally absent once asleep. How many have that physical characteristics? And then look at how many of those can respond to suggestion therapy. There are obviously far more than the 20 we first published. We know there are more because we've talked to some of them and we've seen their reports in the social media, but we don't know how many. And that's the challenge to my colleagues who take care of these adult patients, to find out how many there are. We know there's probably going to be a lot of that 40-some% who are either undiagnosed or refractory to all normal treatment.
What can you say to the skeptics who say patients get better on their own? Many find your claims too incredible to believe. Even you were flabbergasted.
I mean, we know that things can get better on their own, but is it conceivable that this many patients get better just when we talk with them? That's not natural history. That's not just, we know from history, that patients do get better without any treatment. That's been seen in the Brompton data. We're just reassurance, enabled, I think, about 50% of patients to get better within a month. And we know from the Mayo data, from their archive data, that patients did get better spontaneously, a median of 6 months or something like that. But 25% were still coughing 5 years later. Okay, so like any other illness, there can be spontaneous improvement, but with as much observational data we have, it's not credible to say, well, this would have happened even if you hadn't seen the video. Or so that's I think that's fair scientific to accept the observations, what we call observational data, as compared with controlled clinical trial data. If you did one patient and he got better doing anything, that could have happened anyway. But when you've got a couple hundred patients that have got better from suggestion therapy, it's not credible to say, well, that would have happened anyway. But we know that's not so from the Mayo data, the Brompton data. It's good that we have some natural history data from those two sources.
There are so many awesome cures to choose from. This is about Anders, age 44. He had read Dr. Weinberger's work and thought that Dr. Weinberger only consulted with parents. Anders' horror cough started when he was 7 years old. He has been horror coughing for about 37 years.
My name is Anders Morley, and I live in New Hampshire. I am 44 years old, and I only very recently stopped coughing. My cough began rather mysteriously when I was 7 years old. I can still remember the day. It was November of, must have been 19 85, 86. And I woke up one day and I had this sort of scratchy feeling in my throat that suggested to me that I needed to cough. And so I coughed. But the thing was, I didn't feel sick, and by that time I was old enough to know what it felt like when a cold came, and that usually a cough was accompanied by a runny nose and a feeling of weakness or a muddled head, but there was none of that. It was just this cough. So I still don't know what caused it to start, but it persisted for a few days and then weeks. No one really seemed to notice it at first, but eventually, people in my family started teasing me about it. And my father, who is a doctor, he's an orthopedic surgeon, so nothing to do with coughs, always called it a nervous cough and just told me that I needed to stop doing it rather brusquely, usually. Or he would just ask me, what's agitating you? Or some things like that. And in my mind, there was no association at that time between agitation and this cough. It was just there was a scratchy feeling in my throat constantly that never went away. And so I coughed all the time. This dry sounding cough. But I was absolutely convinced that there was something in my throat causing this cough. By the time I was in probably about 8th grade, it had become enough of an annoyance and a concern to me that I asked my parents if they would take me to a doctor to try and figure out what it was that was making me cough. So they took me to an ear, nose, and throat specialist who ran a series of tests. And he couldn't find anything. He said maybe there was a slight kind of buildup of mucus in my throat, but nothing really that seemed unusual. He ran some allergy tests, determined that I had a series of mild allergies to things like tree pollen. By that time, I had seasonal allergies every spring and early summer anyway, so I was aware of that. And, that didn't really explain the fact that my cough lasted 365 days a year. So that ended up not really going anywhere. And again, I kind of didn't think about it for a very long time, and it just became part of my identity as I entered adulthood, and my friends knew about it, and they would, friends and family would joke about the fact that they could always identify me in a busy public place by just listening for my cough. Or in a bookshop, they could, know where I was beyond the shelves because my cough was always audible. Grew up, got married. My wife continued in the tradition of sort of teasing me about my cough, benevolently, mind you. Although sometimes people that I lived, in close contact with would get annoyed at my cough, kind of understandably. But I was just convinced that it was a part of who I was. Sometimes I would try to will myself to not cough and succeed for maybe a couple of weeks at most, but it would just required constant concentration, and then would very easily break. Then I think it was 2019, right before the pandemic, I got to a point, as happened periodically, when I would start, getting anxious about my cough and wanting to do something. But I thought, I'm like, I'm halfway through life here and I've still got this stupid cough from when I was 7 years old. And so I started Googling around, and eventually I hit upon this video of this girl called Bethany talking to this Dr. Miles Weinberger, who was able to sort of just very calmly and patiently, although it didn't require that much patience because it was a pretty quick process, but just kind of talk her through this. And it was like, to me, it seemed almost like he became this voice, he entered her own head and like gave her voice, the voice inside her head that could tell her to do things, more confidence, because he was, this authoritative pulmonologist. That's how it seemed to me anyway. And he just, kept repeating that she didn't need to cough, or words like that, for longer and longer stretches of time, starting out in very tiny increments. And what this seemed to do to me was enable her to find the confidence within herself to be able to go for these longer and longer stretches of time, until eventually it got to a point where she wouldn't need, this voice from outside to do it. And I was quite intrigued by this, and I kind of sat, I was doing this sort of in my free time. I had other stuff to do, but I kind of tried to follow along with the video. But then somehow I thought, I don't know, maybe I need to find, a pulmonologist who works with adults, because maybe this technique is, works with kids who are more trusting of the doctor, or maybe I've had my cough for too long or something like that. And so I was intrigued, but sort of forgot about it. And then COVID came, and there was sort of this break with the past, and you forgot everything that you were doing before for a couple of years. But then last winter, I started to think about this again, and I remembered Dr. Weinberger's name just because I thought it was a great name, Miles Weinberger. So it hadn't slipped from my mind. And in a moment of free time, I Googled his name again and kind of looked over the Bethany video again, and I thought, you know what, I'm just gonna try to get this guy's email address and send him a message and see if he'll talk to me, and maybe he knows someone who deals with adults using the same methods. Anyway, so I sent him an email, and very quickly heard back from him, and ended up setting up a Zoom talk. And we talked for quite a while. I don't remember exactly what we said, but we didn't really go through the process that Bethany went through. But he pretty much convinced me that he was convinced that the mechanism was not different, that this habit cough existed in kids as well as adults. If you never dealt with it and never got over it as a kid, then it was going to stick with you. And so I had seen the Bethany video, and so I knew how it worked. And so all I had to do was, practice going for longer and longer stretches of time, and learning that I had it in me to stop coughing. That I didn't really need to cough. And so I did go back to the video and did it again. And I was lucky at the time because I was doing a lot of driving for work. So I had like this stretch of time for 3 or 4 months where I was doing like 3 or 4 hour drives all the time. And normally I would listen to music or audiobooks, but during that period, I used those drives to just really focus on. I made sure I always had a big bottle of water with me, and I would use those drives to kind of focus on not coughing and getting used to this feeling of not coughing, and then realizing that there was nothing in my throat that was making me cough. Sometimes this involved speaking. So one of the kind of strange side developments that happened with my cough when I was an adolescent and my voice was changing, I just developed kind of like this complex about whether my voice sounded sufficiently manly or whatever, because I was this tiny little kid and I was kind of late reaching puberty. But anyway, so this somehow this all tied in with my cough. And so now often when even decades later, when I'm speaking in public or something like that, before I start speaking, I instinctively clear my throat, just because I think like something's gonna be caught in my throat and it's gonna make my voice sound strange when I open my mouth. So I was going around working and doing a lot of public speaking events, and I started to practice. This was very useful to me. I started practicing just jumping into these talks I was doing without clearing my throat, consciously not clearing my throat. And I was able by doing that to kind of really convince myself that there was something to this Dr. Weinberger method. Now, since then, I have pretty much been able to stick to it. I was coughing for, almost 40 years. And so I certainly don't expect to just stop from one day to the next. The last 6 or 8 months, I've gone through some periods of stress when I kind of let my guard down and stop thinking about it and start coughing. But then as soon as I become conscious of that, I'll stop myself and say, wait, you know how to not cough. There's no need to do this. So it's getting better and better. And at this point, I'll go for days, weeks without coughing at all. And I look forward to the day when it just, the idea, just the need to cough is nowhere in my consciousness, just that it wouldn't even occur to me as a thing to do because I'm anxious or something like that. So that's my story. And I'm very grateful to Dr. Weinberger for being willing to work with young patients and to have it put out on the internet where people can see it and see that it actually works. People like me who then just stumble across it and then are able to apply the method to their own lives and make their lives a lot easier, make life better for the people around them who have to listen to them coughing all the time. Especially, you never know, there's going to be another pandemic, and having a habit cough is not a great thing when you're out in public and everyone thinks you're giving them COVID or whatever that pandemic happens to be. So I'm grateful, and I think that's pretty much sums up my story.
Another favorite cure comes from the state of Indiana. Jessica, age 45, had a 3-year, long COVID horror cough. She was bedridden, hopeless, helpless, forsaken, lost, and beyond desperate. She actually found Gracie's video and then watched the video of Dr. Weinberger curing me. She figured that she had nothing to lose and everything to win. She was right. She watched my video and was cured in mere minutes. Now she is back to her wonderful life.
My name is Jessica Terranova. I live in Fishers, Indiana, and I've lived in Indiana for 15 years. The start of my horror cough began in April 2020. I was at work, and I do believe that I contracted COVID-19 through my job. I worked in the funeral and cemetery industry, and weeks later developed some signs that I had COVID, ended up getting a COVID pneumonia with a terrible cough. And I tested positive for 8 weeks straight every Monday during COVID. So I was home most of the time. So I went back to work with a cough. It is now 2023, and my cough never went away. And I had numerous doctors that I went to. They tested me for everything. I had lung lavage, bronchoscopy in 2022. They tested me for sarcoidosis, silicosis, every cancer you can think of. And it's just been it was an ongoing battle. It affected my personal life, my private life, my jobs, and it really affected me mentally and emotionally and physically. So the cough was nonstop. I did not cough. I do not cough when I sleep. And every test that I've gotten for pulmonary function testing, every test from the surgery came back negative. Everything was fine. They couldn't figure out what was going on. They referred me over to a rheumatologist. They did find inflammation. That was the only thing they can find in my blood on my SED rate. Everything else came back completely fine. They took 22 vials of blood from me, and they said I had pulmonary fibrosis, which I do have scarring on my lungs from the pneumonia, but it's not to the extent as to why I was coughing this way. The PFTs, the pulmonary function testing, were coming back at 103%. I was not compromised of any oxygen. So, the scanning of small scars from a pneumonia didn't make sense with the cough that I had to any doctor. So all they could do is monitor. They couldn't give me any medication because my oxygen saturation level was fine. They just couldn't figure out what was going on. In my desperate attempt, I kept searching and searching because I knew something was out there. I knew I could just feel it, that something was out there and that I did not want to live my life like this at all. So I went on YouTube and I found a video talking about habit cough, and I decided to try it. I clicked on the video that had a link on how the therapy for this was administered, and it was Dr. Weinberger instructing Bethany on how to control her cough and take over, like being back in control of her body and her mind, and not the cough take over your life. And I immediately got so emotional because I knew this was what I had immediately. So I started performing it, and I was doing it at work because I didn't want to wait till I was in a quiet room and that night. So I was so desperate, I started doing it at work, and it really helped. Within the first day, I noticed a decrease. It was a dramatic decrease. My daughter and I, my daughter's 15, she lives with me, and we calculated together that I was coughing about 530 times a day. So about 30 coughs per hour. And that's completely gone. I have about 2 to 5% left. And I'm just so grateful for finding Bethany's video. And I thank her and Dr. Weinberger and Bethany's dad, Dennis, for, supporting me in this and really being my cheerleaders in this, with their messages and believing in me and making sure that I'm doing well and giving me updates and seeing how I'm doing. But I do believe that a lot of people, I've already spread the word at hospitals for doctor's appointments, and I've met nurses and doctors that their family members have a cough going on for years that they've developed, and I've already given my information to them and Dr. Weinberger's information because I really want to help other people. I never realized how much a cough can affect your life until I went through it myself. You just don't know until you go through something, and I'm just so grateful that my cough is pretty much gone, and I have maybe 2% left because I'm still working on it. It's a thing that I've been doing for 3 years, so it's going to take my body some time. And Dr. Weinberger did tell me that it'll take about a month for my inflammation to go down. But I've been doing this for about 3 weeks now, and I'm already 95% cured, if not 98% cured. And I'm so thrilled. I feel like I can have my life back. I can go back from where I was at 3 years ago. And, at 45 years old, you don't realize before all of this, my body felt like a 20-year-old. I was very athletic. I was active, and that cough just threw me down so hard, and it made me feel like I was in my 80s. I barely worked for the last 2 years because I was bedridden from the cough. And now that Dr. Weinberger helped me, I'm able to help other people and spread the word, and that I'm living proof that this is exactly what I had, how he helps other people is exactly what I had, and I'm so grateful.
Dr. Weinberger is a much sought-after speaker about his habit cough cures all around the world. He has spoken live and via the internet to pulmonology teams at King's College in London, Johns Hopkins in Baltimore, Texas Children's Hospital in Houston, Northern California Kaiser, Richmond Children's Hospital, University of North Carolina, Miller Children's Hospital, as well as National Children's Hospital in Washington, D.C., and more. The world will always thank the renowned medical doctor from the University of Iowa who cured me, and all the children and adults from around the world. One medical director told me that my video will live on to cure millions of children and adults. I was just a patient who was cured. For me, it was just a moment in time. This man is Dr. Miles Weinberger, MD. Now he's not just my hero, he is the world's hero.